Friends, good morning. At any rate, it is good morning from India.
Good
But by
morning.
and large, we are conducting this program out of Ras Al Khaimah in the UAE. And we are directing this program to our 10,000 plus participants in the RAC Biggest Weight Losers Challenge. 50% of these individuals have actually weighed themselves in RAC hospital, and the balance 50% have weighed themselves at clinics and at home. And the population is spread across the entire UAE. Now, may I request that during the webinar, except for the speakers, if all the participants could mute themselves, we would not have any disruption at all. Now, today, our topic is best diet, and I believe we have found one. Now, if you were to look at the popular diets, you know about, or you will have heard about, or you will have read about the low-fat diet, the high-protein diet, the GI diet, the GM diet, the keto diet, the intermittent fasting diet, the paleo diet, the Atkins diet, the Pritkins diet. Now those are popular diets that you read about in the newspapers and are propounded on TV. But if you were to go to a hospital, for example, with a medical condition, then you would hear about therapeutic diets. And in therapeutic diets, you have the metabolic diet, you have the diabetic diet, the cardio diet, the cancer diet, the arthritic diet. You also have a separate diet for sportsmen, that is a high protein, high calorie diet. And then you have diets for pregnancy, lactation, and so on and so forth. And not to forget the very famous DASH diet, diet for controlling hypertension. And then, of course, from our alternative therapists, we have a whole range of diets, and that would include the naturopathic diet, the water diet, the fasting diet. And as if that was not enough, amongst our world-leading specialists in the area of diet and nutrition, you have the American school that talks about the benefits of the raw food diet, which means you eat uncooked foods and vegetables only. And then you have a strongly promoted vegan diet. And if you were to go to Europe, well, then you have the Mediterranean diet. And if you were to look at old school individuals like me, who have been reading about diets for the last 50 odd years, we stay with the balanced diet, which is foods from everywhere, all types of foods in limited quantities. But only recently, maybe a week back, I came across a low-calorie, high-fiber, Middle Eastern diet. And I thought to myself, this is excellent. This is the diet that we need to promote from RAC hospitals for all our participants. And it was put together by none other than our own Chief of Dietetics, Ruba Al-Horani. Now, I'm going to spend a few minutes talking about Ruba. Ruba is the head of the Department of Dietetics in the RAC hospital. She is a local girl in a manner of speaking and has done her studies at the RAC Medical Health University, which is right next door to our building. And she has 8 to 10 years, a decade of experience, and her experience spans across the entire spectrum of, she's a certified diabetic educator, and it spans across the entire spectrum. In RAC Hospital, she prescribes diet for inpatients, outpatients, individuals with cardiac ailments, neuro patients, hyperlipidemia, endocrine, the entire spectrum. And as if that is not enough, Ruba is a health coach. And I have often heard, to my delight, Ruba talking about the benefits of exercise and the need for a good night's sleep. She prescribes diets to sports persons. She prescribes diets to older individuals like me. She prescribes diets to children. And she does this with the authority of being a member of the American Academy of Nutrition and Dietetics, the Arab Nutrition Association, the UAE Nutrition and Dietetics Association, and the Emirates Medical Association. My colleagues who are part of the RAC Biggest Weight Losers Challenge, this next hour could be your most important hour for the entire month. It is my great pleasure to present to you our own Chief of Dietetics, the Head of Department, Miss Ruba El Haroni. Ruba, it's all yours. Thank you.
Thank you, Professor. Thank you for the nice introduction, and good afternoon, everyone. It's very nice and it's very good that we gather all around here to talk about such an important topic, and to highlight the, let's say, not only the benefits, the challenges that happens with most of us during following any specific dietary plan, and let's call it a change as it is. So let me share with you my slides so we can start. Can you see it? Is it visible?
Absolutely.
Okay, it's visible, yeah?
Yeah, perfect.
Okay. So the first thing that I would like to highlight, talking about why are we doing this? Why are we following dietary plans, or why are we engaging our selves or bodies in such an important thing? Many will, let's say, get confused and would not know the perfect or the right way to direct their bodies and health towards the best what is suiting the health condition. So this is where we stand here to help and guide all our patients, to enlighten them about the benefits of following specific dietary plan and what is actually more suitable according to their health. And person A and person B are totally different. You need to know that what is applicable on you will not be applicable on someone else. And you have to, before starting any dietary change or habit, you need to understand that this is not something temporary, it's something permanent, and it's mostly it's going to be a change, a lifestyle change towards what is best to your health and to your body. And we are starting talking about what is the diet cycle. You need to understand it. Very importantly, that once you will be on a diet, you start a diet, there will be some kind of restriction, right? So what are these restrictions? This is favorable according to the health condition of each person. And then somehow there will be some gap, let's say, or you will be depriving certain type of food that you are used to. Could be fat, could be extra calories. It depends on the pattern that you are following. You may have cravings, yes, of course, in the beginning, but this is where you have to start understanding that the body is going to react and going to benefit and going to start being on the healthy pattern. So you should not stop at any point where you start. You should not look behind, and you need to understand that if your body is giving you alerts, it needs to show you or like alert you itself about something that your body has been lacking for a lot of time. So this is why we need to understand the difference between types of diets and what is suiting you. And you should not always get it as, let's say, or think that the diet will fail you. You do not fail, okay? There is no failure in this. So the cycle of guilt that you may be feeling ahead, how you break it, you should first, as I said, clear your mind. There should be some kind of goal setting, and then you should not push yourself. You should take it easy. This is why we are always going to be supporting you in different ways, and it is always helpful to have some kind of support in the environment itself, whether from family or friends. This is very important. And you should always keep on track or on your progress, whether it's a diary or like a phone journal or like whatever motivates you. Okay, and it's always good to show it and share it to your health profession, so we know where are you at the moment. We will be going through the diet therapy. I need you to understand what is the benefit of the dieting itself and how it affects your health in general. We will gonna talk about the fad diets, which is very popular now. And then we will enlighten the strategies about managing your weight and how to control or maintain for the longer run your health and your weight as it is. In the beginning, you need to understand that obesity is no more something neglected. It is a chronic disease, and it can lead to different health conditions. It can progress something or worsen something that already you are suffering from. And help you or helping people who are called obese, it should be a part of a team. So it's you're not going to be alone in this. You should get a support from the psychologist, from a physiotherapist, whatever it takes to put you on track, as it's a part of multidisciplinary team that goes all together for you to maximize your benefits. Talking about obesity, back then, in 1975, it was not as worse as in 2020, what we have reached now. Almost 39% of adults aged 18 years and are overweight, were in 2016, and 13% were obese. Now, talking about the status of 2021, the numbers has not only doubled, tripled. So we are talking about a lot of very high numbers of the population, and unfortunately, 1/4 of this population are children. And how to categorize ourselves, it's very important to know that we are using some kind of measurement or like reference. We call it body mass index, that shows us where is our body or how is the weight is reflected by our height. People who get the score of 18.5 or less are called underweight. The normal ranges would be between 18.5 and 24.9, and then 35 and above. 35 and above, they are 25 to 30, they are still overweight. 30 and above, they are obese, and then we can categorize them to morbid obesity and etc. So this is can be measured by your weight over your height, and it gives us an idea where you are. People who are actually with higher body mass index are on higher risk for developing chronic diseases. And research has shown that weight loss of 5 to 10% of their weight loss can actually decrease the risk of cardiovascular disease, Not only that, it can improve the blood pressure, cholesterol, triglyceride levels. It can help controlling the blood sugar. And this is very important to be associated with getting sufficient energy suitable to your body weight, having efficient sleep. This is very important. And obesity actually can influence your sleeping. Some people who cannot breathe properly, or they will develop sleep apnea. They cannot sleep because of the burden of the extra fat on their body. This is the complications or the comorbidities mainly that you can develop from being obese. 55% actually with weight loss. People who are depressed, it has improved. Their sleep apnea has improved. If they are asthmatic or with any problems of upper respiratory tract infections, it is always very important now, especially in the winter. You have to be aware of that weight has a significant influence on your health itself. Of course, we talked about the heart diseases, blood pressure, even gastroenterologist problems like for example, acidity, bloatiness. All of that can be resolved by just losing extra body weight. And then other issues that can obviously be reflected on your health apart from the medical conditions. People can fall into depression or isolate themselves. They can feel shame or guilt itself and all of that. So this is very easily can be avoided or improved by losing the extra body weight. Now, we need to understand that a lot of people, they claim or talk about different type of diets, and not all are scientifically based. So what are these diets and how can we differentiate that? It's very important to understand that, because person A cannot prescribe any diet for you, okay? And they don't know your medical history or how your body will react. It should be, your health should be evaluated by a professional, and then be advised by a suitable diet. And we usually refer to this kind of diets, fad diets. They are sold as a very fast approach to lose weight. Yes, you will lose weight, of course, but these diets are usually deprived in nutrients. They can be deprived in calories as well. Eventually, you will lose weight. But what are the consequences on the rapid weight loss? What are the longer term, let's say, effect of these diets? You need to know that it has so many influence on your health concern. So a person with chronic kidney disease cannot go on a keto diet. Keto diet has been very importantly popular. Now everybody is following that and claims that it does magic. Yes, of course, eventually you are restricting calories and restricting carbohydrates, so you will lose somehow weight. Although some of these diets may be recommended in specific situations, but obviously they need to be supplemented with nutrients, as they lack certain nutrients, certain benefits. They might be less in fiber, less in vitamins, and then healthy gut bacteria. So it should be any diet that would be followed, not for a long time, and it should be under supervision after getting a proper consultation, and then of course should be supplemented if it is not a complete diet. A lot of studies has been issued on these kind of popular diets. I will highlight on the intermittent fasting, as it's actually showed some benefits, but if it is done on the proper way, of course. And there is other some kind of diets that has shown a lot of benefits and effects that people are actually now following. and it improved their lipid levels. It has improved the mortality and mortality rates. So it is always too important to check the background of any diet. Most popular diets that we are seeing people are following, whether it is cultural belief or religion belief or whatever, they are good in their way, but anything that is unbalanced, it's incomplete. Okay, majority or most of these diets that have been followed as the vegan diet, vegetarian diet, paleo diet, pescatarian diet, lacto-ovo-vegetarian diet. And I'll explain the difference between that. The terms of vegan, vegetarian, lacto-ovo, and pescatarians, they are almost the same. They are falling under the category of vegetarian diet, but a person who's completely avoiding animal product, yes, we can call vegan. And then some people, they still have dairy in their product or some animal products like eggs, we can call them vegetarian. Lacto-ovo, still they avoid animal products, but they are still having eggs or milk in their diet. Pescatarians, they are completely vegetarian, but they are eating fish only. Paleo diet is somehow similar to Atkins diet, or what we call it keto diet nowadays, but it has different phrase, minimal difference between it, but it has the same concept, which is restricting the carbohydrates and sugar and increasing the fats to an extreme level with the protein as well. And I'll just have a hint or like a small comment on such a diet, because when we do restrict certain macronutrients, which is the main source of energy, the carbohydrates, we agitate the body to enter like a state, we call it a ketoacidosis. It can reach very high levels of ketones in the urea. It can affect or worsen someone condition if he's having blood sugar, elevated blood sugar, or having a problem with the kidney, someone with tendency of increasing their uric acid levels, because in such a diet you are focusing on protein and you are focusing on fat up to certain level or extreme level. So this is what aggravates the high level of uric acid in the body, which is again inflammation, causing inflammation in the body. So moderation is the key. You have to remember that, moderation and balance. Another different type of diets that we have seen, the chicken diets, the zone diets, intermittent fasting, as I mentioned earlier, blood groups, the HCG diets, the low carbohydrates diets, and there are so many other diets. Highlighting the diets that are basically focusing on the same concept, which is increasing the protein level higher than the normal levels. We are talking about the Atkins, keto diet, zone diet, orange paleo, gluten-free, and Mediterranean. This is the slight difference between them. If we can see the food groups, we can see the non-starchy vegetables. It's included in all of these diets. Starchy vegetables, non-starchy vegetables like the leaves, the salads, the starchy vegetables like potatoes, legumes. So it is somehow, in some extent, acceptable in the zone diet. It is there in the Mediterranean and the gluten-free diets, but it is restricted again in the keto and the Atkins diet, and so on for all different food groups. As you can see, basically majority of these diets, they limit sugar, they limit fat, they limit refined foods, and they focus more on the protein and the healthy fat itself. What is the perfect structure of a diet plan that you should follow without naming it, before naming it? As recommended for a healthy adult, The diet or balanced diet plan should include at least 4 servings of vegetables and 3 servings of fruits to maximize the fiber intake and vitamins to ensure that you are taking enough vitamins. To replace the refined grains and processed food with whole grains, we have a rule in nutrition. We say make half of your grains whole. If you are consuming rice and bread on a daily basis as a cultural behavior, then you need to make sure that what you are taking is a good quality and in a controlled portion size. And then minimal intake of fats, which is the unsaturated fats, the healthy fats. It includes vegetable oil mainly, direct fat from some kind of food or vegetables like avocados, nuts, fish, lean protein, legumes, all it give us healthy fat. And then we should cut as much as possible the sugar. I'm not talking about the table sugar. I'm talking also about the food that contains naturally sugar. Even the high glycemic index, we call it, or the high glycemic or the high sugar containing fruits should be avoided or limited up to certain amount, because again, it's sugar and calories. And to make sure that our intake from dairy or animal products or protein to be lean and to be low in fat. And it shouldn't be, the concept of losing weight shouldn't be called a diet or a program. As I mentioned, it's a lifestyle. It emphasizes on a healthier eating pattern, engaging ourselves in a physical activity, this is apart from daily work. Some people, they will claim that, oh my God, I'm so hectic, I have a so hectic work pattern, I keep walking, or I'm walking under the sun. No, this is not physical activity. I understand this, you need certain or higher needs of different foods, but again, your body got used to this level. Then if you want to see difference or you want to see influence on your health, you should go beyond that. It's either you restrict your calories or you increase physical activity, or you actually need to do something different. If you are used to walking or climbing the stairs every day, then you can do some yoga, some stretching exercises, something that you are not actually doing on your daily pattern or routine. Then you have to also make sure that you are losing weight gradually. You should not do it all at once, because the tendency of gaining weight back again is higher when you lose higher percentage of the weight. But to highlight that, people who have higher body mass index in the beginning, of course, they will lose more because they will have some extra water retention, some extra fat. So there will be some kind of a ratio that we should also monitor closely and advise accordingly. So it is fine, but this depends on the body mass index. So people who are having BMI or body mass index higher than 35, in the first 3 months, there should be a minimum 15% loss of the total extra body weight. After achieving a healthy body weight, it's very important to do a maintenance phase, which majority of the people, they neglect or they forget to do so. So after you achieve the weight, okay, it's not only like you reach your goals and you have progressed this much, and then you are very happy, so you get back to your old lifestyle or eating pattern. You need to understand that the body got used to this weight, that the weight you were actually on after a long period of time. Let's say you've gained it in a 2 or 3 or 10 years time, then you have lost it in a 1 year time. So the body needs time to adjust to the new weight. Otherwise, you will gain it. And once you gain it back, it will be very effective or will actually affect your health. So you need to be careful in that. Maintaining would be by still somehow doing some kind of restrictions, but not to the same extent that you were doing, and engaging yourself in physical activity. more often, not dropping that, because maintaining weight as it is, as per recommendation to maintain weight, you should be active for minimum 150 minutes in a week. But to lose weight, minimum 300 minutes in a week, you should be active. Active means not doing light exercises. It is like moderate to high intensity exercises. There is different strategies to do or to lose weight. As a start, it's completely changing the mindset, and then improving the lifestyle by having a better diet or eating habits, and increasing the physical activity. You should be self-conscious, you should monitor yourself, and you should also have the feeling of guilt if you have followed or let's say had eating something differently from the pattern that you started following, and then we can, in extreme cases, we can go for other strategies. Strategies would be for the third-party help. It could be a surgery, it could be some kind of specific herbal or specific remedy that we advise according to the condition. People who tend to have let's say effect on the weight by having different mentalities, they are exposed to emotions, let's say, they should closely be monitored. They should be advised also to see or work with a therapist. It's very important, and they also should do everything step by step. Otherwise, and make sure to set the goal of minimum 5% of the total weight, to make sure that they maintain it for the longer term. I mentioned previously about physical activity, that if someone is completely sedentary, they should gradually start increasing their physical activity. Otherwise, it should be 150 to 300 minutes per week, moderate intensity, or 75 to 150 minutes of very high intensity aerobic physical activity that focuses both on breathing improvement and fat loss, or increasing the metabolic rate. Keeping a food diary or like a log, it's very clever thing to do, because we human tend to lose a lot of information. We tend to forget. So this is the perfect way to document everything that you are achieving or you want to achieve. And it's a proper, let's say, way of communicating between you and between the health professional. You should not only note what you have consumed, or what are the things like you have eaten, or what you are following. It should be also monitored. What is your emotions? If you have taken this salad, what made you eat this salad, for example, or this dish? Was it just because if you want to change whether your diet, or whether you are following a diet plan, whether you are happy to have this dish, whether you are, for example, your family has prepared this dish. So it's very important to understand and monitor this emotion to see or to evaluate you according to that, and put you onto a category of if you are being influenced by emotions or no. Diet should be balanced and should be restricted according to the health condition. It should be monitored, and it should be a combination of the most or the basics macronutrients that gives your body energy, which is carbohydrates, protein, and fat. But we need to look into the good part of each. Healthy carbohydrates, lean protein, and healthy fat. Okay, and the amount, it should be decided upon to your body needs. It can depend on your age, gender, health background, health conditions, activity level, stress level. All of that will influence the type of diet you will be following. The other strategies, all the other strategies that we have talked about has failed yet, or there is like, for example, an extremity in your health condition that may require an extra help, then we can tend to choose another way, or a helpful or a third way that will speed up the progress of the weight loss, or help in worsening any health conditions that you are on. As we know, there are so many popular surgeries are going now, and non-surgical procedures. Okay, you need to understand whether it is suitable for you or not. It's not just a trend, because in the beginning, when we started doing surgeries, weight loss surgeries, it was just for helping improving certain conditions. But as I can see now, it started to become a trend. So you need to know that within 4 to 5 years, if you have not improved your lifestyle after doing any surgery, the body will expand to the same size that you were on. So again, you were gonna go back to the same starting point. So you need to be aware of that, and you should not put it as the first starting point. This is the last point, or if you have any specific conditions that urges us to help you in weight loss, and those people with extreme body mass index, these are the people who are requiring this kind of help. Other non-surgical procedures way of helping in weight loss, obviously there is so many different kinds, but all are with side effects. Okay, so nothing contains doesn't have any side effects. All are with side effects reported, whether it's 1% or 10%. There are other ways also, using some FDA approved drugs or herbal treatments that should be under provision. And again, after discussing this, I want you to understand this doesn't work alone. You need to start from the beginning, which is, again, diet, healthy eating pattern. So this is just extra help for those who require it. Okay, eventually you have to do diet or to maintain a healthy eating pattern, and you have to increase your physical activity. Weight loss and weight maintenance therapy should be based on comprehensive weight management program that includes diet, physical activity, behavioral therapy, and then it combines different aspects, and then it helps you for the longer term to maintain the weight and maintain the health. Talking about the diet, after discussing the importance of following a balanced diet, based on so many studies, actually, and scientifically evidenced studies, research has showed that the most effective currently in 2022 diet is the Mediterranean diet, that actually focuses on balancing all different food groups that I've discussed earlier: the protein, the carbohydrates, and the fat. And basically this diet It's a way of eating based on the traditional cuisines of both like Greece, Italy, other countries like all the border of the Mediterranean Sea. It is a plant-based food, majority with whole grain, focusing on vegetables, legumes, fruits, nuts, healthy fats, herbs, spices, and everything that is healthy and supporting the gut as well. It emphasizes on unsaturated fatty acids. It limits refined sugar again, but it includes up to certain level carbohydrates that actually healthy and that supports your immune system, your body health in general. It's including the fruits and whole grains that will provide you with fiber that majority of other diets actually are lacking. Yes, it include up to certain level higher fat content than the other diets, but this is considered as a healthy fat. Again, your body needs somehow fat. If you go less of one of these three, the carbohydrates or fats or proteins, less or higher than what your body needs, then definitely you will have a side effect. Okay, and how to decide that? Okay, you should get a proper consultation to see the amount of fat in your body, the amount of muscles that we will evaluate you, or the health concern physician, they will evaluate you according to that and will explain this to you that this is suitable and this is not. For certain health conditions, we tend to yes, prescribe different diets, but this will be always for short term. Mediterranean diet can be a lifelong diet or lifestyle eating pattern that will not have any side effects and eventually will help you on losing weight without restricting so many things in your food. Majority of the sources of the unsaturated fat or the healthy fat are plant-based food or fish. So this is the difference between the high protein or the ketogenic other diets that emphasizes on animal-based. It could be hormonal fed, it could be treated with other drugs, we never know the source unless if you see it by yourself. So this is always safer way of dieting. As an example of the Mediterranean diet or meal plan, options in the breakfast can be like oats, it could be whole grain cornflakes, bran flakes, it could be cereals, but the cereals that are full of fiber, low in sugar. It doesn't have any additives. It could be skimmed milk, low-fat milk, or it could be animal, plant-based milk like oats milk, almonds, and all of that. It includes fruits, a piece of healthy or lean protein, an option of whole wheat carbohydrates. It emphasizes on 2 to 3 servings of fruits every day. So you can add it to your breakfast or to your snack time or as a dessert, as you wish, but it should fall under the same pattern because there is specific, let's say, it's a balanced macronutrient. So if we do not follow it in the proper way, we cannot call it a healthy eating pattern. The herbal teas can be taken, the caffeine should be limited, water should be taken into the suitable amount that each person needs. It should be between 8 to 12 glasses. If someone with higher body index, they can consume more, but if they are with certain or health concerns, then we restrict it up according to their needs. the protein that you can or highly depend on, the lean protein. It could be fish, or it could be like white skin, light skin animal proteins, or again plant-based proteins, like for example lentils or dal, tofu. It could be turkey, chicken, all used or prepared in a healthy eating cooking methods. You can enjoy a glass of caffeinated beverages, but it should not exceed 300 milligram of caffeine on a daily basis. Salt should be kept restricted as well, because extra salt or extra table salt, it can cause somehow water retention in the body. Again, everything that we are eating, it contains sodium, it can contain other minerals. So we need to keep an eye on the added sugar and added salt itself. Again, spices, there is no limitation, as I said, in this diet. You can freely add spices, but not in excess. You should not do all your food like spicy food, because again, it somehow increases the metabolic rate, but it may affect or influence your gut health. So everything in moderation is good for you. These are my references, and I'll be happy to take any question if there is. So, thank you.
Thank you. Thank you. Thank you, Ruba. Thank you. That was both interesting and educative. Interesting from the aspect that you spoke about the various aspects of fad diets and your explanation of them, which included the Onish diet and the blood group diet. That was fascinating information. Educative, because in the last few slides, you gave us that outstanding diet that you created. The low starch, low fat, high fiber, Middle East diet. That is a winner. And I would really strongly recommend that diet to the 10,000 followers of our RAC Biggest Weight Losers Challenge. I must tell you, friends, that it was so good that we uploaded this tip on our website. So if you want any further information, have a look on our website and you will get all the information you need. And that is not all. Ruba is part of our expert committee. So you just have to send in a mail or give us a call and you will reach Ruba and she will provide you all the information that you will need on this important journey of weight loss. Thank you so much, Ruba. Thank you so much. You make the RAC Hospital proud. Well done. Well done.
Thank you.
Dr. Wilco, questions, sir?
Yes, sir. Thank you so much, Ruba, for a wonderful presentation. You have covered almost everything. We can still wait to listen you for a long time. So that's a very great thing. We have received many questions and we are seeing in chat box also so many questions are coming up. I will try to compile a few questions together. First question I will take, Mr. Hassan is asking, he is facing constipation, please. He is facing constipation and he has started drinking 2 to 3 times of water or 2 to 3 glasses of water, but still facing issues. Ruba, can you just give a suggestion?
Okay, you want to okay, so just first of all, usually the best remedy for constipation is increasing or adding fiber to our diet. But with adding fiber, you need to know that to make it go, okay, to help the gut get rid of the, let's say, extra food, you need to add or have plenty or adequate fluids. So if you increase the fiber and you did not increase the fluid up to certain amount to balance between these two, it's still you are gonna have the same problem. You need to monitor yourself. If this chronic constipation is happening more often for a prolonged period, then you have to get further investigation. But if it is just for certain time, then you need to try to help yourself get a home remedy. Like, as I said, plenty of fluids. You need to lower your protein and fat intake for some time, because this is what actually increased the constipation from happening more often. And then adding more fiber, adding more fruits and vegetables, specifically more fruits and vegetables, plus increasing the water. The body needs water approximately 1/3 of the body weight. So if you are, for example, 70 kg, then approximately 2.5 liters of fluids or water, that's what your requirement. So try to hit the requirements and see how it goes. If it doesn't improve for longer period of time, then get yourself tested to see whether it is something else aggravating this problem.
Yeah, thank you. The biggest problem people are facing, those who are obese, generally they suffer from diabetes and metabolic syndrome. So I would like to compile two questions together from Mr. Bharat, and second is Milagros. Both of them have the similar type of questions. Grossly obese, type 2 diabetic, and on insulin also. And the lady Milagros is asking, she is currently breastfeeding. Is it advisable for me to take a low carb diet? And Mr. Bharat is also asking the similar question. His grandfather is diabetic, is on insulin. His BMI is 29.5. What diet protocols you should suggest them?
Okay, for a breastfeeding woman, she has different requirements. Usually we calculate her needs. Let's say if she needs 1,500 calories, we increase 400 to 500 calorie extra from what she should be taking or consuming. This kind of calories, it should be focusing more on protein and on fluids. Okay, not and like nutrient dense food, not calorie dense. So carbohydrate, to an extent, if you want to restrict it while you are breastfeeding, you should restrict the sugar itself, not the carbs itself. But you can have whole grain still include carbs, but it will not affect your body weight, because eventually if you go lower than that, you will influence the milk supply and the quality of milk itself. It may be more watery, not caloric dense. So even the child can be affected. This is if we are talking about if you are 6 months before, if the baby is less than 6 months. 6 months onward, no, you can restrict more, have more restrictions in your diet, because the baby might be depending on food as well. So usually we tend to advise the weight loss can be like initiated after the 6 months. If before 6 months, take take advance, like you can increase your physical activity, increase your fluids, not to influence the milk supply itself. But you still can lower the carbohydrates, but not to a very low extent. You should always try to see what is actually increasing your body weight. Obviously, might be the sugar, might be the processed food. These are the carbohydrates that you should be avoiding. Now, talking about the other question, answering the other question, if someone is diabetic but on insulin, this is a totally different aspect of diet that should be planned for him, because they should be following a concept called carb counting. According to the amount of insulin that he is receiving, the patient is receiving, we are deciding the carbs that he's taking. There is different formula. That's why it is better to refer him or to see an expert or a dietitian, because they can do a training, a specific training for him about the carb counting. Just a brief, every 1 unit covers 15 grams of carb, which is a serving of carb. So if he is having, let's say, a curry in the morning, and then 2 chapatis. Then the carbs is coming from where? Okay, he needs to understand first that chapati, for example, or the bread will give him 30 grams of carbohydrates. So this covers 2 insulin units. So it's like a kind of equation that he should be aware about, knowing what is the amount that he is taking in his food. Accordingly, the insulin, it will be affected, influence. And then he should be aware that he should not do a restrict diet, because if someone on insulin, they are more prone to going into hypo, which is an episode of very low blood sugar, if they are skipping their meals or they are eating less than that they should take. So it's always advisable to refer to a health professional that will guide you to the amount of carbohydrates or insulin that you can take, and monitor closely. Thank you.
Yeah, thank you, Ruba. There is one more question, similar question, but little twist. Harshad Singh is asking, my mother is diabetic and has gout. What diet she should follow, and is it safe to have high protein diet?
I actually touched this point at the presentation. I mentioned that people with high uric acid or gout disease, they are not advisable to go into a high protein diet, because such a diet will emphasize on red meat, let's say, or more protein, or emphasize in even if it's plant-based protein like legumes. These are 2 things that are high in purine. High purine food will eventually influence the amount of uric acid, or it will end up in a higher uric acid level. So it's not recommended for such people. What kind of diet? If they are diabetic and uric acid, they should restrict the calories and the fat. They should go for a balanced diet, lower in carbohydrates, higher in healthier fat, and moderate in protein.
Yeah, thank you, Ruba. There is one interesting question. Mr. Prashant is asking, I have BMI of 40. Even if I moderately work out, gym or swimming for 90 minutes a day, 6 times a week, do I need to follow 1200 calories, or he can go a little higher calorie? So
yeah,
I think,
as I said,
yeah,
as I said, the amount of calorie for a person, it is dependent on the age, on the gender, and physical activity, and then weight, and so many factors. So one important factor is the physical activity. If he is on a sedentary lifestyle and he requires 1,500 to lose weight, he needs to go follow at 1,200 calorie, little less than what he is needed. And then if he is actually exercising to that extent, then no need for restricting the calorie as low as 1,200, because we need to preserve the muscle mass and maintain a good energy during the exercise. So focusing on more quality food in the low glycemic index food, carbohydrates that give energy for longer time, plus supporting the protein, the muscles with good protein portion, is the best advised plan for him.
Yeah, thank you. There is one interesting question people generally ask, and many times we come across with this question. Ritu is asking, drinking hot or lukewarm water full day will increase metabolism? We have answered many times, but Ruba, you are the best person to answer this, whether hot and lukewarm water is helpful.
It's good for cleansing the body, of course, but it does not have any effect on increasing or decreasing the metabolic rate. Yeah, there is no evidence-based studies or anything that says or claims so.
Yeah, we have received few questions in the mail also. I have forwarded 2 of them to you. Similar question I'm taking up here. Vidya is asking, PCODs ladies, what they need to eat and what they need to avoid?
PCOS is a condition that actually it affects the hormones. So such women will have a tendency of less metabolic rate. So we try to focus on the food that are lower in calories but higher in nutrient content. We try to avoid the hormonal food. It could be, as I said, from animal-based or sometimes refined or processed food. Basically, that aggravates the hormones, such as dairy. We try to not to restrict a limit up to certain amount, and if taken, it should be only to a very small extent. If they are depending on animal proteins, it should be lean, and we are trying to focus more on fish rather than chicken and meat. And try to drink a lot of water, and not to forget such women will suffer also from some insulin resistance in their body, so they're slightly going to have elevation in the blood sugar, so they should be aware of sugar intake, whether it's a natural source or artificial or processed. So it should be highly restricted for them, the sugar itself.
Yeah, thank you, Ruba. Generally, during the consultation with the patients, we come across the gastritis and ulcer problems. So there is one interesting question Mr. Ilyas is asking. For ulcer problems, can they go follow intermittent fasting? And is there any side effect?
There is different kinds of ulcer, but if we are talking mainly about gut ulcers, we know that people who are suffering from ulcerative colitis will have more acidity, tendency to have cramps, episodes of diarrhea or constipation. So following or fasting for a long time, it's not favorable in their to their body, as it may aggravate the acid, and then eventually it can worsen their symptoms. Up to certain extent, if they are not on a flare-up, certain times, like he can do 1 or 2 times, or just simply do not follow the very restricted intermittent fasting protocol. It should be like at least the maximum fasting should not exceed 12 hours, in my opinion.
Yeah, thank you, Ruba. There are many questions which are similar and we have already answered. The best part, the point you mentioned during your presentation, every individual is different. So for particular needs, for individual needs, you should be following with your consultant for a proper guidance. And because we are talking for weight loss challenge, so we are generally going through a mass people. So we are picking up the common questions now. So I would rather add to your point, Ruba. Everyone should be motivated, determined, and focused. So then only you will achieve good weight loss. And temporary weight loss is not good enough. You have to maintain. You have already mentioned many points. Having fat diet, following a fat diets, and if they are having a small and immediate effect, but on long run it is not a good thing. So that's what is the thing. At last, I will ask you, what is your takeaway message?
As I said, they should always remember that it is going to be a lifestyle change. They should understand that losing the weight and maintaining their goal, it should not be only up to certain point at their life. They should reflect that to their family as well, because we are teaching our children, and our children are being reflected, are influenced by our behavior as well, whether it's eating behavior, whether it is any kind of behavior. So obesity, as I mentioned, is increasing, and it's a disease, and it is affecting and influencing other health concerns. So let's start the change by ourselves and help the next generation build a healthier lifestyle, so we can improve the quality of life for their life and try to minimize the all health conditions that we are now facing nowadays. Make sure that you are doing it properly, gradually. Make sure that you are having a balanced diet, and try to always aim for maintenance, maintaining the weight that you have lost, even if you did not reach 100% the goal. If you have reached only 50%, please maintain it, because there always a time that you can have a little bit rest, but then you can continue afterwards. And don't give up. We are always here to help you and guide you, and all the best.
Yeah, thank you, Ruba. Only 2 points at the last I will mention. Number one, we have noticed in the chat box also, and just suggestion for all the participants. If you require any individual type of consultation, please write a mail to support@rackweightlasschallenge.com. We will answer you back on your email and we will guide you. That was number one. And number two, definitely, if you have any queries, you can come to us. And if you miss something, you can log into your page, your this portal, Weight Loss Challenge portal. You can see all the health tips, all the video recordings, everything is there. If you find any difficulty, please let us know. We will support you. Professor, over to you, sir.
Thank you. Thank you, Ruba, once again. Thank you. Those questions were at best brilliantly answered. Thank you. Dr. Wilco, thank you very much for bringing out all those questions in a very clear way. Thank you so much. My thanks go both to Ruba as well as Dr. Wilco, and also to all our participants who come in every week to listen to what we would like to say in order to help them on their journey of weight loss. I'd like to thank all the behind the scene workers, starting with the Department of Dietetics. Thank you so much for supporting us over here. The IT department, Arabian Wellness, the entire RAC hospitals, thank you. Our next topic is exercise and obesity, which is the other hand, in a manner of speaking, in our journey to weight loss. Ruba has spoken about the dietary aspect, and now we will have in our next session, which is on the 15th of January, we will have Dr. Madhurima, who will talk to us about the other aspect of exercise during obesity, or exercise in order to manage obesity. And with that, friends, thank you so much. Have a great day. Goodbye.